Standardized nursing terminology development. Approach used to develop the best terminology. My role as a GI nurse has equipped me with new concepts and ideas that can support the future of medical practice. Several nursing terminologies are also used in our practice to improve the outcomes of many patients. The important thing is to identify various terminologies that have the potential to support the health outcomes of many patients. This knowledge makes it possible for our nurse manager, NM, to embrace the best terminology that can deliver the best results. The terminology is implemented depending on its domains and approaches. Such approaches are useful for supporting the needs of different stakeholders. Powerful decisions are made to ensure the terminology supports the health needs of more patients. The Omaha Home Healthcare (Omaha System) terminology focuses on 4 major domains. Such domains include physiological, health-related behaviors, psychosocial, and environmental. The important goal is to offer the best interventions depending on the identified health conditions. The approach used to develop the best terminology follows a unique path. The first step is identifying the nature of the healthcare setting. The field usually focuses on different patients experiencing problems with their gastrointestinal tracts and digestive systems. This knowledge makes it easier for the department to embrace different terminologies. The Omaha system has been widely embraced because it encourages different practitioners to identify the health problems affecting their patients. The next thing is using the terminology to deliver the best interventions. Capturing the above terminology in nursing practice. The Omaha Home Healthcare terminology has been widely used in different healthcare settings. The model identifies several problems affecting different patients. For instance, nurses and caregivers can use the system to identify several problems affecting their patients. Such problems are usually separated into 4 major domains. Such problems can be health-related, physiological, psychological, or environmental. This understanding will therefore make it possible for different nurses to offer appropriate interventions to the targeted clients. Surveillance can also be embraced to support the health outcomes of different patients. Many organizations and groups have approved this language. The American Nurses Association has also approved the language because it has the potential to support the changing health needs of many populations. This approach made it easier for many institutions to embrace the benefits of the terminology. Medical organizations should therefore embrace the terminology to achieve the best health outcomes. For instance, numerous magnet institutions have embraced the above terminology in an attempt to deliver quality patient care. Appropriate implementation and use of different terminologies. Several methods can be used to ensure more nurses implement and use various terminologies consistently. To begin with, nurses should be equipped with new ideas regarding the use of various terminologies. Medical facilities can offer powerful training programs to educate their patients. This approach will make it easier for them to identify the terminologies applicable in different situations. Hospitals can also have appropriate frameworks and policies regarding the use of different terminologies. Nurses can also be empowered and equipped with the best skills to deliver the best care. This strategy will make it possible for more nurses and caregivers to support the health needs of their patients. They will also be ready to embrace the power of different nursing terminologies. The use of modern informatics and theories will encourage more practitioners to use different terminologies. Data collection for meaningful use. The Omaha system encourages nurses to collect the most appropriate data to deliver the best interventions. This nursing terminology focuses on 4 areas that determine the health of an individual. That being the case, nurses can use modern technology to acquire accurate data and information. This data can therefore be used to understand the health issues and problems affecting the targeted patient. This discussion shows clearly that the terminology supports the concept of data collection for meaningful use. Hoffman and Podgurski define it as the continued acquisition and use of modern technologies to support the health outcomes of different patients. The above concept encourages medical practitioners to use different electronic health record (EHR) technologies to improve efficiency, safety, and quality of care. The information gained from the use of EHR strategies will make it easier for nurses to use the best skills and approaches. Modern informatics can measure the projected health outcomes, thus improving the quality of care. EHR technologies can promote the best diagnostic processes. This approach will improve the nature of interventions used by different caregivers. Information systems have the potential to improve the quality of decisions, care, and support availed to different populations. This practice should therefore be embraced to advance the nature of nursing practice. Benefits and barriers of using standardized terminologies. The use of different nursing terminologies can produce numerous benefits for both caregivers and communities. For instance, such terminologies have the potential to improve the level of communication in every nursing department. The model also encourages nurses to embrace various interventions, thus producing the best health outcomes. Schweirian believes that such terminologies can improve the quality of patient care. Such terminologies also make it possible for nurses to follow specific standards and ethics. These facts explain why medical institutions should embrace and implement the use of different nursing terminologies. However, some barriers make it impossible for many institutions to embrace the use of these terminologies. For instance, many institutions do not inform their practitioners about new terminologies. Also, some institutions lack adequate resources to support their use. Nursing schools also fail to educate their students about the importance of such terminologies. Some problems encountered in healthcare, such as nursing shortage and reduced morale, discourage medical practitioners from embracing these standardized terminologies. Standard for nursing language. It is appropriate to have a standard for nursing language. This is the case because nursing is a universal practice aimed at supporting the health goals of many patients. The standardization of such languages will make it possible for nurses to apply them in different healthcare settings. Also, health institutions will implement such languages effectively, thus promoting the best medical outcomes. The approach will also make it possible for many caregivers to offer standardized care to their patients. The practice will also make it easier for nurses to embrace powerful concepts such as EHR. These strategies will eventually support the health outcomes of many underserved communities.